So let's say you're working in the emergency room and two patients come in with similar stories. I'm drawing them both unhappy here because they both feel really bad. Nobody wants to go to the emergency room. But the main reason that they're here is because of a cough. And it's a pretty bad cough. But that's not all they have in common. They've both had a recent viral upper respiratory illness. In other words, they've had the cough that we're talking about, but they've also had fever, sore throat, and a runny nose or rhinorrhea. People around them have even been describing their cough similarly, as a barky cough. When you listen to them breathe, you actually hear the same thing in both of them. You hear a high-pitched sound when they're breathing in called stridor. Both of them are working kind of hard to breathe, called increased work of breathing. They both look sick enough that you get labs, specifically a CBC, but it's not all that helpful. In fact, it comes back normal in both of them. Now, what if I told you the first patient with appropriate treatment is going to do fine, but the second patient, even with good treatment, has a pretty high risk of actually dying? It's a little bit scary because these two patients to this point look very, very similar. But this is the situation we're in when we're trying to decide whether a patient has the very common croup or the much more rare but much more deadly bacterial tracheitis. So we're going to need a little help here. We're going to need to find out a better way to differentiate these two. Well, the first thing might be to look at the patient's age. Croup most commonly affects kids aged 6 months to 3 years. Bacterial tracheitis has a much broader range. It can affect kids from age 6 months to age 14 years. Another clue might be the appearance of the kid themselves. In croup, the patient looks sick. They look like they've got a pretty bad illness, but they don't look like they're on the verge of dying. Bacterial tracheitis, on the other hand, they look much sicker. In fact, they're described as looking toxic. They look like anything could push them over the edge at any second. Going back to their vital signs, patients with croup certainly can have a fever, but usually it's low grade. Something 99, 100, maybe 101. Kids with bacterial tracheitis, their fever is often high grade. 103, 104, or even higher. Getting a good history is important because it allows you to decide whether the cough was acute onset or slow onset. With croup, the cough is often insidious. They were coughing a little bit and then a little bit more, and it slowly developed into the full-blown cough that drove them to the emergency room. With bacterial tracheitis, they had an acute worsening of their cough. It happened suddenly. A great way to try and tell the difference between croup and bacterial tracheitis is just to treat them for croup. Give them a trial of racemic epinephrine. Kids with croup will respond. Kids with bacterial tracheitis won't. If the kids are sick enough to get a blood culture, kids with croup will have a negative blood culture. Kids with bacterial tracheitis may have a positive blood culture. Maybe. Blood cultures might be negative even with bacterial tracheitis. Another thing that might, but doesn't always help, is to get an X-ray. Let's take a look at why. This is an example of an X-ray that could have been taken on either one of our two patients. The left-hand image is the frontal view of the neck, and the right-hand image is the side view. Here on the frontal view, you can see their trachea here as this dark structure that goes up the middle. If you try and follow the trachea up, it gradually narrows to a point. You'll hear people describe this as the steeple sign. On the lateral view of the neck, you can see the trachea here, but as you follow it up, it slowly disappears. These findings are caused by the swelling in the upper airway, gradually closing off the trachea in the region of the vocal cords. Unfortunately, this appearance can be seen in both croup and bacterial tracheitis. But there are some things that you would only see with bacterial tracheitis. Let's check them out. Here are two patients that both have bacterial tracheitis. This first patient, you can see his trachea is very irregular. That's because in bacterial tracheitis, the infection forms mucopurulent membranes. And when those stick down to the side of your trachea, they make it look irregular and cruddy looking. That doesn't happen in croup. In the X-ray on the right, we can actually see some of those membranes have dislodged and gone into the trachea. These are the same things, but now instead of being stuck down to the side of the trachea, they've dislodged and are in the center of the trachea. This is a dangerous situation because those are the membranes that can obstruct the airway and cause respiratory failure. Let's go back to our list. One last thing you can do, if it's still difficult to tell the difference between croup and bacterial tracheitis, is to take a direct look at the airway. This is called bronchoscopy. In croup, you'll see swelling and redness, but not much else. In bacterial tracheitis, you'll see those membranes. Once you see the membranes on bronchoscopy, you have your diagnosis of bacterial tracheitis. You can culture the membranes, secure the patient's airway, and start them on antibiotics.